MPs are calling for urgent action to put more money into what they describe as a ravaged care system, supporting older and disabled people in England. Responding to a report by the Levelling Up Housing and Communities Committee, the government insisted it was already putting an extra £5.4 billion into adult social care over the next 3 years. Well, let's talk to Sir David Pearson, who's an independent advisor on social care, who chaired the UK government's social care sector COVID-19 support task force. Well, thank you so much for joining us, Sir David. Now, first of all, the concerns around the future of social care have been going on for years. How much more do you feel, how much more severe do you feel the situation is now?
Sure, thank you, and thank you for the introduction. I am speaking in a personal capacity as far as this afternoon is concerned. So I think what we need is a bridge between the current crisis affecting social care and the very laudable aims of the White Paper Health and Social Care Act and the White Paper regarding the future of social care. And in terms of what more needs to be done, the report highlights some important issues, such as what they've described as a £7 billion funding gap, which sounds like a lot of money, but for the benefit of viewers is only about 0.7% of current public expenditure for something which affects millions of people up and down the country in terms of the care that they receive, and also something like 8.8 million unpaid carers, which has increased significantly since the pandemic. And what we've also face at the moment is serious workforce shortages. Skills for Care estimate that the vacancy level of 110,000 last year has gone up to 165,000. That's out of a 1.5 million care workers. So we need a long-term strategy for social care and a really robust workforce plan that involves paying people in social care equivalent salaries for the same role as they are in healthcare, making sure people get the right training and development, and in my view, ensuring that people are registered so they have the benefits of registration, which involves some responsibilities, but also that accreditation and development that is so badly needed in the social care sector. To be fair to the government, they have produced a white paper which covers this and things like technology-enabled care, which will help enormously over the coming years, integration of health and social care, which is also extremely important. So a lot of those changes, as well as the changes to who pays for social care, something like changing the thresholds for means testing of care services, all those things are extremely good and are very much welcomed. But there is a big job to do now, urgently, in order to invest the kind of things that are needed to make sure that social care is sustainable for the people of this country in the future.
And I know hindsight is a wonderful thing, but as I said, this is a concern that's been voiced for years now, the future of the social care industry. So do you think more could have been done in governments of the past years, decades, in order to put us in a better position today?
I think the debate about social care and the funding of it, who pays, has been going on for something like 25 years. So clearly the answer is yes, but we are where we are. And I think the opportunity now exists with the kind of changes that have been signalled by the government for the future, to add some flesh on the detail of what those proposals will look like around technology, workforce and so on, as well as making sure that albeit we've got to be careful about public expenditure, I fully appreciate that, but the importance of this for the people of this country cannot be underestimated, and therefore to go the extra step to ensure that it is properly funded now will make a huge difference, because we've got a very difficult winter ahead of us for the health and social care system as well as the country as a whole. So we want to be in the best place we can to ensure that the people of this country get the services they need and deserve.
David, thank you for your time. That's Sir David Pearson, an independent advisor on social